It's croup season, yes! And in this video, I'm going to be telling you everything you need to know about this barky cough and what you can do for your kid at home. So if you want to become a smarter parent, hit that subscribe button and stay tuned. So in this video, I'm going to be answering the 5 most commonly asked questions so you can decrease your anxiety and increase your knowledge. Question number 1, what is croup? Besides being the most annoying cough on this planet, what exactly is it? Croup is a viral infection of the upper airway. It causes inflammation around your voice box and your windpipe, which kind of constricts the airflow, so when you cough, you sound like a seal barking. It will typically occur in younger children between the ages of about 3 months to 4 years. This is because when kids are younger, their airway is a lot more narrow. As your child gets older, the airway gets less narrow and the chances of them getting it start to decrease. Question number 2, what is croup going to look like? It will typically start out like a cold, and if they get enough inflammation in that airway, they can start to develop that loud barky cough that's characteristic of croup. The loud cough will also get exacerbated by more coughing, more anxiety, and crying. It's kind of like a vicious circle, okay? When your child gets it, they're gonna start going into these coughing fits. It's gonna get, the more they cough, the more anxiety they're gonna get, and the more the symptoms are gonna go up and up and up. They can also get a fever, have a hoarse voice, and loud breathing called stridor. And it's always gonna happen in the middle of the night. You're gonna be sound asleep, all of a sudden you're gonna wake up to your child screaming and yelling and sounding like a barking seal. Question number 3, what can you do for your child? There are 3 things I always like to recommend to parents, and the first thing is to calm your child down. The more agitated your child is, the worse the symptoms are gonna get. So calm your kid down, and the best way to do that is for you to stay calm as well. Once your child is settled down, you're gonna get a much better idea of how bad the croup actually is. The second thing I recommend is to wrap your child in a warm blanket and take them outside in the crisp, cool air. This works great. I use this on my own son when he gets croup, and he gets croup quite often in the wintertime. And we use this on our own son, and it works fantastic. The third thing I recommend to parents is to go into the bathroom, shut the door, shut the windows, turn your shower on full steam. Turn it on as hot as you can, full steam, and sit in there for about 30 minutes. This is my go-to. If it's too cold outside or taking them outside doesn't work, I do this. This is my go-to, and it works like an ice cream dream as well. Question number 4, do I call an ambulance for this? Like always, it depends on how sick your child is. If your child is able to calm down and go back to sleep, then let them sleep and rest. If the symptoms tend to last longer than 3 days or they start to worsen, you may want to consider taking your child to an urgent care center, family doctor, or even take them to the emergency room yourself. If your child's breathing is really loud and wheezy, or their breathing rate is a lot higher than it normally is, then I would definitely call an ambulance, especially if you start to see those lips turning blue, okay? If you see those lips turning blue, this means they're not getting enough oxygen, and yes, call an ambulance right away. Question number 5, what would the paramedics do for your child? As per usual, we would do an assessment, vitals, and obtain a very detailed history. The first treatment option for us, depending on the severity of your child, so obviously if you've called an ambulance, it's gonna be fairly severe. So the first thing we're gonna do is give them an epinephrine nebulizer. All that is it's kind of like an oxygen mask you put over their face that has this mist coming out, and in that mist is medicine, epinephrine, and what that does, it's gonna help open that airway to give that immediate relief and to help your child start to breathe a lot better. So the second thing we would do is give them something called dexamethasone, which is a steroid anti-inflammatory, and this will help with the inflammation in that airway to bring it down. This is going to help with some more of the prolonged relief and to help prevent any kind of reoccurrence. There really isn't a whole lot of other options for the treatment of croup. Even at the hospital, they would do the exact same thing we would do for your child. Only they would probably monitor your child for a couple hours. Then when their breathing rate returns to normal, they'd probably just send them back home with you. All in all, croup is fairly common in kids. It's one of those things that we just have to learn to deal with as parents. My kid gets croup all the time, and I've only had to bring him to the hospital once, and really by the time I got to the hospital, it had subsided simply by bringing him outside in the crisp, cool air and rolling the window down in the car while we were driving to the hospital. In my experience, about 75% of the time, the croup is going to be fairly mild to moderate, where you're going to be able to treat it at home with the tips I gave you. The other 25% of the time, it's going to be probably fairly severe where, yeah, you might want to call an ambulance because it does get very scary. But rest assured, I've never seen croup be fatal or have any kind of long-lasting effects on any child. Just as a parent, use your best judgment. You know your child best. If they look like they're in distress, call an ambulance. You know, like I always say, when it comes to your kids, when in doubt, call an ambulance and let us deal with it. Guys, if you enjoyed watching this video and you learned something new, make sure to give it a thumbs up, hit that subscribe button along with that bell icon so you can get notified every time I upload a new video. And don't forget to comment below and let me know if you've ever had any experience with croup. And also let me know what kind of topics you want me to cover in future videos. Thanks for watching.